Yes,
Can I come in?
yes, please.
Hello, my name is Dylan. I'm going to be your nurse until the morning. I'm relieving the daytime nurse. Can I get your name and date of birth?
My name is Fain Anyeni.
Alright.
My date of birth is 11/27/1970.
And do you have any allergies?
Yes, I'm
What?
on Sicilian.
And what happens when you take that?
I get bumps and itching and a sore throat.
Okay. Can I check it with your wristband? Alright. I'm going to check it with the chart as well. And when I came in, I performed hand hygiene and then also provided privacy for the patient. Alright, we're going to go through a head-to-toe assessment. I'm going to ask you a few questions, do a little movement, review your systems, and if you have any questions, just feel free to stop me at any time and ask. And if you feel like you're more exposed than you like, then we can change it up and assess the situation in a different way. Is that okay?
Yes.
Alright, so I'm going to ask you your name and date of birth again.
My name is Fain Anyeni. My date of birth is 11/27/1970.
Alright, and do you know why you're here?
Yes.
For an assessment, is that correct?
Yes.
And you know where you're at?
Yes, in hospital.
And you know the date and time?
Yes. It's October 23rd, 2021.
Alright, can you tell me how many fingers I'm holding up?
2.
Can you cover one nostril for me? And cover the other one. Take a deep breath through your nose. And do it again for the other side. Alright, are you in any pain?
No.
Patient not showing any signs of distress, which could be sweating, labored breathing, grimacing. Patient's sight is intact by being able to visualize 2 fingers. Patient's hearing is intact by listening to commands and reacting appropriately. And patient is alert and oriented times 4. Patient has no pain. Alright. I'm gonna shine a light through your eyes, do a little neural assessment for you. You just have to look at me. Checking patient's eyes. Pupils are 3 centimeters. Patient's eyes are parallel, equal, reacted to light. And let's see. Can you look at the tip of the pen for me? I'm gonna bring it closer to you. And back. Alright. Equal, reacted to light, and accommodating to light, and reacted to direction as well. Alright. I'm gonna listen to your lung sounds. Clean my stethoscope. I'll just have you take a deep breath. I'm gonna listen to your front, your sides, and then your back. Every time I replace the stethoscope, just take a deep breath in for me.
Okay.
Alright, lean back for me a little bit. Can you lift up your right hand arm?
Say that again.
Just lift up your right hand arm for me. Take a deep breath in. Stop alarm. I'm gonna have you lean forward for me. Normally I'll be doing this with the patient skin to skin, but for demonstration purposes I will not be. For the back I'm gonna be looking for C7. Deep breath for me. And we're going from side to side, assessing the lungs. Next spot of T10. Breath sounds are clear to auscultation anteriorly, posteriorly, and laterally with no adventitious sounds. Alright, now I'm going to listen to your heart sounds. Just lay back for me.
You want me to lay flat?
No, just lay back. So I'll listen to your heart sounds with the stethoscope, the diaphragm, and then I'll listen and switch it to the back. Palpating. Going to the right hand side, second intercostal base, the aortic. Pulmonic. Tricuspid. Herbs. Now can I have you lift up your left breast and move it to the outside for me? And this as well. I'd also do this skin to skin. Now keep that position for me. I'm going to switch the stethoscope. Using my landmarks to know my place. Okay, you can relax your hand. Sorry about that. Alright, patient's rhythm is regular, heart rate is 82, no murmur or extra heart sounds noted. Alright, I'm going to have you lay flat for me. Alright, can you lift up your shirt for me?
Want to use this?
Yeah, you can use that.
It's okay.
Alright, so I'm going to inspect the abdomen. I'll probably lift up the bed to eye level for me, where it's easy for me to bend down. I'll be looking for any signs of cyanosis, pallor, jaundice, erythema. I'd also be looking for distension, any abnormal pulsations. I deem that there's nothing. Skin is, contour is normal, round, brown throughout. Alright. So after inspecting, I'm going to auscultate. Did I say that right?
Let's go to it.
Alright. I'm going to start at the right lower quadrant. I'll listen for 1 minute. Upper right quadrant, listen for 1 minute. Left upper quadrant, listen for 1 minute. Left lower quadrant, listen for 1 minute. Patient's bowel sounds are normal active. And when was your last bowel movement?
This morning.
This morning?
Mm-hmm.
Any discomfort, any pain?
No.
When was the last time you urinated?
Just before I got to the office, just before I came here.
Okay. Any burning, tingling, hesitation?
No.
No. Okay, I'm going to palpate. Can you lift up your knees a little bit for me? All right.
Both of them?
You can lift up both of them. A little bit lower. Just slightly. Alright. Tell me if there's any pain.
No.
Okay, so I palpated with one hand, going 1 centimeter, light palpation. Alright, you can lower your shirt for me. And then I'm going to assess your lower extremities. Here I'll be checking above the knees, doing my skin assessment using the back of my hands. Patient's skin is dry and warm for the lower extremities and brown consistently throughout. I'll be checking the posterior tibialis. +2, dorsal pedis. Dorsal pedis is +2. Checking cap refill. This patient has nail polish, so that won't be able to see from the nail beds. So I can always use the pads at the bottom of the feet. Cap refill is less than 2 seconds, times 10 for lower extremities. Okay, I want to have you do a movement. Just relax for me right now. I want you to do that same movement for me. Okay, now we're going to do it with some resistance. Toes to your head, perfect. Toes down, that's good as well. Range of motion for the lower extremities is full, and strength being 5 out of 5. I'm gonna have you sit up for me. You're gonna come back over here. Okay, you put your hands in my hands. Turn them over for me. Radial pulses is +2. Cap refill for the upper extremities is less than 2 seconds, times 10. Alright, I'm going to do one motion with your hands. Just relax for me. And then can you do the motion again by yourself? Then we're going to do it with some resistance. Come up to your head. Alright, a little bit harder. There you go. Keep your hands over here. And then come down with the same effort. Alright. Upper extremities, 4 range of motion. Strength 5 out of 5. I'm going to do some hand hygiene again. I'm going to assess the upper skin. I'm going to put my hands on your face. And if the patient was in a gown, then I'll feel the shoulders and down to the arms, the hands. Upper skin is dry, warm to the touch, and brown consistently. Alright, now that the head to toe assessment is done, I will lower the patient to the lowest bed setting and angle the bed as appropriate, and I'll have the call bell and reach. Is there anything I can do for you before I leave?
No, nothing. Am I okay? Everything's okay?
Everything was within normal limits.
Thank you.
Alright. Thank you. Just end it if you